Introducing the Trilogy Evo. So for the Trilogy Evo, when we're setting it up, initially we use a dry circuit or a passive circuit. So you can see we have a filter that is always at the patient end before your exhalation port. This is your exhalation port. We don't need a pressure line for this machine, so the pressure line needs to come off before you set up the Trilogy Evo. I'm just going to call it the Evo. So you make sure that you cap that off. And you take the pressure line off and you can discard that. It's not necessary. So we've got our lovely patient here. We're going to slot the filter straight in. So all inhaled and exhaled gas are now filtered because this is our exhalation port. At the machine end, we plug the filter in this side. If you're short of filters for whatever reason, then it's okay not to have a filter that end. But the circuit happens to come with a filter either end, so we generally use both filters, and that just slots onto the side. Okay. Like the Trilogy 202, the Trilogy Evo will deliver home ventilation, non-invasive CPAP and BiPAP, as well as invasive modes, but we're just going to have a look at non-invasive BiPAP and CPAP today. So you've got your on button and your alarm silence button. They're the only buttons on the machine. The rest is touch screen. So if we turn the ventilator on, we come to our home screen. So this is the Trilogy Evo front screen. So this is the screen you'll see when you first turn the ventilator on. You can see you've got a home button in the top right hand corner, and then you've got a settings button, which is a little cog. The machine will default to the last settings the machine was on. So in this case, the machine was ST. Passive is the type of circuit you've got. So your dry simple circuit is a passive circuit that I just showed you. So ST passive is bi-level non-invasive ventilation. You can see you have your IPAP, your EPAP, your breath rate or your backup rate, and your inspiratory time. You also have your FiO2, how much oxygen the patient is receiving. If this is what I wanted for my patient, all I'd have to do is press my start ventilation button, and then I would be in bi-level non-invasive ventilation in BiPAP at an IPAP of 15 and an EPAP of 5. There's a lot of information on the screen. The things that we're interested in are how much leak we've got. So we want our leak to be relatively low. The ventilator will compensate up to a leak of 60 litres a minute. In COVID-19, we try to keep the leak as low as possible so we don't have non-filtered exhaled gases circulating around. But we set the leak for patient comfort also. The mask can't be too tight, otherwise the patient won't be able to wear it for very long. They won't be able to comply with the therapy. So a leak of between 7 and 25 litres is probably about perfect. We can see on the right hand side our FiO2, so how much oxygen the patient is on. We can also see our respiratory rate on the right hand side. Peak inspiratory pressures, tidal volumes and minute ventilation and I/E ratios are all measured also. If I wanted to make any changes to this, I'd have to go into my settings screen. So I'm just going to press settings, and you can see everything that I would possibly want to change comes up. So if I want to change my oxygen, I need to highlight it, and then I can either use my scroll bar, or I can use my plus and minus to change it to whatever oxygen FiO2 I wanted, and to keep your patient within their target saturations. Any changes you make, you see an apply or cancel button comes up. You just need to apply it. Then you can move on to your IPAP and EPAP. So again, that will be medically prescribed. So if we want to change our IPAP, we can either use our scroll button or we can use our keys, and again we have to press apply. Same for your EPAP. Your breath rate is your backup rate, and that will kick in if your patient takes less than 15 breaths in this instance. BTS tell us 15 breaths a minute is a good backup rate to have. We can ventilate people with well enough to keep their CO2 down with a backup rate of 15. So we usually set that at 15, and then we have to set our inspiratory time for our backup breaths. So our inspiratory time tells the ventilator how long to breathe in or blow for on the backup breaths. When the patient is taking breaths spontaneously, the I time doesn't factor. So I would probably have my I time between 0.9 and 1 seconds for a backup rate of 15. Go to apply those settings. Once you're happy with what you've done, then you go back to your home screen and you're back in your monitoring screen again. If I wanted to change my mode of ventilation, so if I wanted to change it to CPAP, again, I would go back to my settings, press my settings screen. I would go to my mode and change it to CPAP. So we have a variety of different modes down the bottom of the ventilator, you can see there. A lot of these modes are invasive modes. The only ones we use non-invasively are ST or BiPAP and CPAP. So I'm just going to press the CPAP button, and then it brings up all the things that you can change within your CPAP settings. So I'm going to change my FiO2. Again, you just highlight it and change it to whatever you want. Press the apply button and you would choose your CPAP. More COVID patients, we're usually finding 10 centimetres of water is about right. And press apply. Go back to our home screen. You can see on the right hand side of the screen we're in CPAP of 10 with an FiO2 of 54%. We've got our respiratory rate on the side and a variety of other measurements. Leak is important, so I would probably amend my mask fit there and bring my leak down if I possibly could, if my patient could comply with that. If you wanted to give 100% oxygen, you've got a little tiny 100% oxygen button in the bottom right hand corner. So if I press that, it asks me if I want to start, and it says for 2 minutes, so that would give me 2 minutes of 100% oxygen. And you can see it counting down. I can also stop that by highlighting the button again, pressing stop. If we turn the ventilator on, the Evo on, and it's in a prescription that you don't want, so if it's on CPAP and you want BiPAP, or if it's on BiPAP and you want CPAP, you go to new patient. Select that you want a new prescription, or you can give it a name if you want to. Press accept. Acknowledge that there's a filter in the circuit, which there is. And then you would go to your settings screen and set up the patient as we discussed, whether you wanted it in ST mode or BiPAP mode, or whether you wanted to go to CPAP. Okay. Let's turn that off. That's the Evo.